Fatima Isaac Ibrahim, a 22-year-old mother of four, is one of more than 800,000 internally displaced persons who have settled in Baidoa, a town in southwestern region of Somalia. Recurrent droughts, worsened by climate change and ongoing conflict, have forced families like hers to flee their homes and rely on essential services provided by humanitarian organizations. But now, looming funding cuts from the U.S. government are threatening those lifelines, putting thousands of children at risk.
I've been coming to this health and nutrition center for 4 years. I received free services. All my 4 children were born here. They got vaccinated, treated, and were given nutrition supplements. I couldn't afford private health care, so this center has been everything to me.
According to Save the Children, at least 55,000 children in Somalia could lose access to life-saving nutrition services by June. The cuts in foreign aid are forcing 121 of their supported centers to shut down. Fatima says she's frightened by the news.
If this center closes, I don't know what we'll do. I depend on it for maternity and nutrition services. Without it, life will be extremely difficult.
Save the Children says the impact of the cuts is already being felt.
The impact of funding cuts has been deeply felt since the beginning of the year. And here in Baidoa, humanitarian and life-saving interventionists were declined or decreased. And for example, Save the Children supported mobile health clinics, which is critical for the treatment of children in IDP camps, have already been closed. And in fact, people who were already struggling with the devastated the chronic humanitarian crisis are in dire situation. And because of the funding cuts, we are putting risk on the progress already being made by the humanitarian efforts. Without urgent fund, the situation will be more critical than the current one. This needs global attention to elevate the suffering of the people in Somalia.
Somali authorities say they are working urgently to find alternative funding sources.
And now the Minister of Health and the international partners, in collaboration with the federal government of Somalia's Minister of Health, we are absolutely came together to to mobilize other sources or other funds from the international organizations, and we are absolutely being or doing some advocacies in order to get the previous funds that are being given by the USAID, because we know that the USAID and also the PHA were among us the most valuable funding organizations that used to cover these healthcare activities.
As the Somali government and humanitarian agencies like the Save the Children scramble for solutions, thousands of displaced mothers like Fatima wait anxiously, uncertain of what the future holds. Mohamed Kahi, CGTN, Mogadishu, Somalia.